Welcome to another episode of Journeys in Entrepreneurship. Today, we have Fola Laoye, the co-founder and CEO of Iwosan Investments Limited, a health investment holding company. Fola was a director at Investment Fund for Health in Africa, a pioneer private equity fund focused on healthcare in Africa. She's a founding board member of Hygeia Group Nigeria, promoters of Lagoon Hospitals and Hygeia HMO. She's also a trustee of the board of the Society for Quality in Healthcare in Nigeria. Interviewing her is Victor Emaye, the CEO and co-founder of Chekker, a digital health platform for at-home medical lab tests in Africa. Victor is also the founder and CEO of Medipa Healthcare. Victor has been working in the healthcare sector over the last 5 years and has helped over 400,000 people seamlessly access healthcare in Nigeria through his health technology platforms. Join us as we listen to their journeys in entrepreneurship in the healthcare sector.
Hello everyone, my name is Victor Emaye, the CEO and co-founder of Chekker, a digital health platform for at-home medical lab tests in Africa. Welcome to another exciting episode of Journeys in Entrepreneurship by Faith Foundation. Today, we have an amazing individual in our midst, somebody I highly respect, in person of Mrs. Fola Laoye, the CEO and co-founder of Iwosan Investments Limited. Today, we are in for a dull time. Welcome, Ma.
Thank you very much, Victor.
It's good to have you.
Thank you.
I've heard a lot about you. I've read so much about you, and it's great to see how much you're doing in the healthcare sector.
Thanks. And I've heard quite a bit about you too.
Thank you very much.
Following
man.
very closely.
Thank you very much, man. It's an honor. Yeah, so down to my questions. I have a lot of questions prepared for you today.
Okay.
And do you want to tell us a bit about your background and what inspired you to pursue a career in healthcare and investment?
Okay. I think I'll start by sort of maybe first of all introducing who I am as Fola Laoye. So I'm a wife, a mother of 2 young adults, one of 4 siblings, and of which all of us as siblings grew up in what I'll call very much a medical household. So that probably is already giving you a clue
Right.
into why I'm doing what I'm doing today. So our parents were both doctors. My father was a surgeon, my mother a physician.
Wow.
But I think what was really interesting about both of them was that they had this passion for training. So first and foremost, I mean, one of the big things they did very early in their careers was to help to establish LUTH, what we now know as LUTH, Lagos University Teaching Hospital. This was in the 60s. They were part of the foundation team that actually opened LUTH. And side by side with obviously giving care in the hospital to lots of Nigerians, they were also really part of the custodians, shall I say, of training doctors and nurses, particularly here in Lagos. So side by side with LUTH is what we call the College of Medicine, University of Lagos, CMUL. I think that's less known, but right there on the LUTH campus is the medical school. And both of them were obviously, great teachers there. So that was the household in which we grew up, one that was quite academic, I would say. So it meant that we all had to pull our socks up and study hard and so on. But also one where, of course, everything to do with medical and healthcare was something that was very familiar to us. Christmas and any major event we spent at the hospital. We spent visiting patients. We spent, really trying to make sure that we could do our own part to give, good cheer and good energy, for healthcare workers, which was obviously something that is always still very much needed. So that was, I guess I would say, my not immediate foray. Of course, I went about it in a different way by first going off and doing finance. And maybe I'll just speak a little about why did I do finance, even though I saw so much healthcare around me. I guess for me, well, first of all, I was extremely numerate. So I really liked maths. Maths was my favorite subject, in addition to football. So my choices were either to become what you call these days a football pundit or to go down the road of finance. So I think my dad took one look at me and said, I'm not sure about this football pundit business. So why don't you tackle something else? And my big brother was an accountant, much older than me. And so, of course, he was very much my mentor. And I thought, okay, let me try and follow his footsteps and see whether indeed, finance and accounting would be something that would also, work for me as a career. So I did that. Did my accountancy at University of Lagos, here in Lagos again, not far from here. So actually, I'm totally schooled here in Lagos. I have to tell you, because I went to Queen's College. I always have to put that in.
Wow.
And then University of Lagos. So, did all that schooling here. Then went abroad to do my what you call the ACA accountancy professional accounting exams, which I did in London in UK with what was Coopers and Lybrand, now PwC in those days. Spent a few years doing that. Came back and worked still in the financial sector. So this was now the 90s, where there were lots of banks and finance houses. So there was a lot of options there in the finance space. So I joined that for a while. But something kept telling me that I needed to still have a career that had more impact. And I guess that must be really and truly from seeing what my parents had done and growing up around them. And knowing that even as they ran the hospital at Louth and they taught, but in all ways, they were always touching lives. Of course, in looking after their patients, but particularly in their students and even research, because they were, at that time, there was quite an active research base as well at Louth. So it did touch me, growing up, that yes, whilst we could do what we could do with finance and so on, perhaps, we still needed to think about how could we make impact. And for me personally, I felt I could make impact in healthcare, because this was an area that didn't have a lot of, shall I say, financial or management talent in it. And it was an area that clearly really did and does need that sort of talent. So I thought, okay, I can roll my sleeves up and contribute here. Of course, it helps that I was always bottle washer, receptionist, computer operator, all the while, in healthcare, whilst my parents were doing what they were doing. So I did get to see healthcare from that sort of more administrative point of view growing up. I should also say that, of course, my parents had also switched from being in the public system to private by setting up Hygeia and Lagoon Hospital. So that's where, as I said, I was rolling up my sleeves already as a kid, doing holiday jobs and so on. So I could see that there was a lot to do to really create even the infrastructure and enterprise to support the patients that were coming in every day, that were being looked after. And so I thought, okay, this could be an area that I really could spend some time and deliver some impact.
Wow, that's very inspiring, I must say. Looking that you schooled here in Nigeria, here in Lagos, and you went to London, right? And from what I read about you, also studied in Harvard Business School. I'm very curious because I've been talking about it right from when I was on campus. I want to go to Harvard. I want to go to Harvard. And I know it takes a lot to go to Harvard. Do you want to share a little more about your journey in Harvard, and also then transitioning to become the CEO of Iwosan Investments?
No, certainly. It does take a lot to get to Harvard, I have to say. And, I always like to let people know that I didn't get into Harvard my first time. Because I think it's important for people to know that, we all go through, our failures as well. And we still have to be even more deterred, and it needs to sort of give us that energy to try again. Yeah. So like you, I also wanted to go to Harvard when I was Unilag. It was just, a major dream of mine. And I applied, even before I'd finished at Unilag. You can imagine. That's how bold I felt, But of course I was, 20 years old, didn't have any experience and so on. And Harvard said, not yet, So I went off and I thought, okay, yes, let me now go and really put some energy into, well, my first of all, my training to become a chartered accountant, which is what I did while I was in the UK. But somehow for me, even apart from the impact, Nigeria was always calling. I never really wanted to jackpot forever.
Right.
Let me put it that way. I jackpot for a reason, because I thought I was there, to do my accountancy. So once I was articled and I got my pali, as they say, my license, I came back to Nigeria and I was working in financial services. And to be honest, the Harvard story only came up again when I then looked around and I said I wanted to pivot into healthcare. So I did make a very deliberate decision at that time to pivot into healthcare. As I said, having seen what my parents were already growing as Hygeia and wanting to support that effort, I felt that, okay, I needed to go and make sure that I could really create what I would call my own entrepreneurial toolbox. Kind of what I guess, those of you who've had the opportunity to come to the Faith Entrepreneurial School also come for, right? To say, okay, I've got the tools that now will allow me to go into the world and feel bold enough to be an entrepreneur. So that was why, for me, Harvard. And again, at that time, when I was making the decision, of course, I thought about other business schools, but Harvard was always the first one on my list. And I guess the US was also very much of interest to me. One, I had already had the opportunity to be in the UK. And secondly, this was a time also where we were beginning to think about health insurance in Nigeria. What would the structure look like? Because we knew that one of the key things that we needed to do from the healthcare perspective was to really create a financial, financial cooperation, proper risk management, and really be able to sort of change the dynamic from what I'll call the out-of-pocket market into one that was a lot more organized. And health insurance appeared to be a key, almost silver bullet, especially from the point of view of an active private sector. Because by this time in the 90s, the private sector in healthcare was beginning to pick up, though again in a very fragmented way, without much in terms of standards and so on. But we could see that there were some early signs. And so the US was also extremely interesting to me at that point, because I really wanted to understand the US healthcare market and understand how health insurance had really grown. Whereas in Europe, we had more of the single payer type system, which was government, but we realized that in Africa, we were going to have to look at something else. So for all those reasons, the US made sense, and of course, Harvard Business School. So put in my application. I think I put it in, very interestingly, the last day, literally, the last day, last round. But obviously it was compelling enough for them to, to say, okay, come over. So did my 2 years there. And to be honest, through my period there, I think I must have done, I would say, two key things. One was to really understand really how the US health system worked, and how the US sort of health management worked, and what were the key issues to think about as we were trying to build up something back home. So I did a lot of that. The other thing I did, which I always do whenever I can, was to bring Africa to Harvard Business School.
Right.
Because, at that time, we were talking globalization, right? This was the .com era. We used to have these lectures. They would come and light up the world globally on screens. And Africa was always this dark continent.
Wow.
So that was the other thing that for me, maybe just having had the privilege that I'd had of growing up as I did and knowing what could be. So one of the things that we did at Harvard was to set up the Africa Business Club, which now runs, till now, to this day, runs a huge Africa Business Conference and really brings, African entrepreneurs to Harvard students and so on. So that was at least the journey of coming to Harvard. And coming back from Harvard, then, I then joined what was the family business, being Hygeia. At that time, my parents had built one hospital, Lagoon Hospital, and we were now thinking about how do we expand this, and how do we also not just expand the infrastructure, but expand the access to care. And I think there were 3 things that we saw that we needed to do to really sort of help the enterprise, of healthcare develop in Nigeria. So access was one, quality of care was another, and then of course the third one being cost.
True.
Now it's a triangle that a lot of, if when you sort of read more, it's like a 2-sided triangle. It should have all 3 sides, but very often it's difficult to really balance all 3 in true. That access, quality, cost. So sometimes you have to go for access and cost, which may be at the expense of quality. And sometimes you want to bring in quality, but then, one of the others suffers. Yeah. So really, I think for me, and maybe if I can put the academic hat on that I had been brought up with, it was really still in doing what we were doing, but trying to see how to make all 3 come together. So with that in mind and joining Hygeia, we set up Hygeia HMO, which was the side that was then, the managed healthcare, health insurance. Of course, I'll touch on the fact that in setting that up was also working with, the sort of the regulatory environment, but we can talk about that a bit more as well. But setting up Hygeia HMO, using that to bring up health insurance, whilst also developing more hospitals and clinics in the Lagoon hospital network. So that then became very much, the work that, I came back to do. We also, at that point, also looked at what we could do on the more foundation side. So we had worked with the Global Fund for HIV/AIDS, so that way we could bring HIV/AIDS care and treatment into health insurance and into a health insurance package. And we did that as well, not just even for what I'll call the sort of, shall I say, corporates and so on, but we also got to do that for communities through community insurance. So very exciting time, a lot, there was a lot to do, a lot was happening, and I'm glad to see that a lot of what we did at that time, has really grown from there.
Wow, it's so much work that you've done in this period. And I know, talking about insurance, I know that there are so many complexities with managing costs and regulation, also the different regulatory changes, fee for service at some point is another thing, and you're just trying to manage it. Sometimes it feels like it's the insurance company that is taking the hit sometimes. So do you want to share some of the challenges that you've faced, right? Setting up, coming from the finance background and now coming into the healthcare industry, then setting up an insurance company out of the hospital that your parents have built?
Well, I mean, yes, I think at that time there were, as you rightly said, what we had to focus on was the need. We had to focus on the community and the need, and how to really create a setup where you could really get more and more people to access care. So I think that was what really, drove us. That was what we were always looking at, to say, okay, how can we make this, more open and more accessible? Good enough, around that time too, there was a lot going on the government side. This was, started just before 1999, when finally we got the law passed of the National Health Insurance Scheme Act. Well, it was a decree in those days because it was actually passed under the military. So it was NHIS decree. But anyway, luckily the civilian government came in and took it up and made it an act. But even after that law had been written, it took about 5 years for it to be executed. And so those of us who were already sort of beginning to work, even without any regulation, we got involved and we started working with government. We had good enough some platforms like the NESG were very, very active in saying, okay, how can we really bring the private sector and government together to work together? So we did a lot of work together to say, okay, what should the operating guidelines look like? How could we really do this? What would be the right, shall I say, basket of care? We knew what were the key areas in terms of non-communicable diseases.
Yeah.
But we also knew that, there was more coming up. How do we also make sure that, as we were discussing earlier, from a diagnostic point of view, we're beginning to see more in terms of the, shall I say, non-communicable diseases, in addition to the communicable diseases. So the hypertensions, the diabetes, and of course, emergency care, surgical care when needed. Of course, maternal and child care being the bedrock of everything we were doing. So we wanted to try and bring that basket together, which was quite a bit. And this is, again, in a scenario where most times government is working on what you call single disease programs. So there's a malaria program, or there's an HIV program. But we were saying, look, we want to look after the family. I want to look after the entire individual. And so health insurance can help us do that, because we can bring that basket of services together, and we can really, think about what would be the, shall I say, first of all, what would be the amount of use needed, which is what the actuarial people come and calculate for you from an insurance point of view, and then of course, what would be the cost. So again, it meant bringing technical skills in that were not necessarily medical skills, but management skills, actuarial skills, financial skills. So I was able to play a role in that, and then we were able to then come up. But yes, it created challenges. It still does, because as I said, as you want to create more access, you have to think about cost, you have to think about quality. And in a market like this, where we still don't make anything, we import almost all the materials that we use in the sector, and costs are high. So it was always trying to pull that together. But at least I think we've seen, whilst yes, health insurance still has a lot to do, we went from 0 to something like 6 million people in a matter of 2 or 3 years. So that was a lot of work to get going. Now the market is, I think, somewhere around 12, 15 million, but we know we're still very far from where we want to get to. In fact, at that time, the President Obasanjo at the time had given us the objective or the mandate of getting to 30 million people, but we're not even there yet.
Yeah, even now. Right. So, that's very interesting, looking at how much work you've put into doing this in the healthcare sector. But I'm curious about Iwosan Investment. It suddenly sprung up one day, and I was like, Iwosan Investment, and I started seeing Iwosan Lagoon.
Okay.
Yeah. So, how did this happen?
So, what's the story behind that?
Yeah. So, what's the story behind that?
So, essentially, I think I've discussed how we got Hygeia going with Lagoon. And what we then did, or one of the things that I then had to do with my finance hat on, was always raise capital. Because I'm sure that is something that we know that healthcare particularly is a capital guzzler, isn't it?
Yes.
So raising capital, and we were doing it as an institution. We always did things, even though we started as a family business, we did things from a corporate point of view as an institution, and we always brought in outside investors and so on. So as part of that, we raised quite a bit of international private equity funding. And so over time, the institution got bigger and bigger, and with more shareholders at the table. So I then took a back seat. We brought in professional managers, and I could spend more time with my kids, because by this time I felt like I'd hardly seen my kids, and they were at an important age. So I then, did less in terms of the day-to-day, whilst I did still try and support the sector in many different ways, including our quality organization, the Society for Quality in Healthcare, and so on. And of course, I also had my consulting business as Health Markets Africa. And then came COVID. And I think COVID was then a major wake-up call for all of us in the sector.
Sure.
And we realized that we were going to have to bring together everything that we could find. We needed to do what we could to support the government, the private sector, and so on, because we all didn't know what to expect.
True.
All we could do was watch what was going on in other parts of the world,
Yes.
and expect that a tsunami was coming towards us. So I rolled up my sleeves again and got involved, at least in the COVID work at the time. And we created actually what was then an isolation center, which was done at the Landmark event center. And that was done in partnership with an NGO that I belong to called YPO. And we were able to really, put together at least a service. We had 80 beds. We had, staff, volunteers. We had about 200 volunteer staff. We had ventilators, an ICU, everything ready to go. We used it for about 5 months, but luckily after that first wave died down, a couple of things happened. One was government themselves were a bit more, prepared, and they had put more resources on the table. Bigger funders like COVID had come up, so at least we were able to tail down. But at least I'm glad that we were almost what I'll call a first responder at the time, and we were able to put that service, for the benefit of Nigerians. So whilst doing that, of course, it had got me going again to say, we still have a lot of work to do in healthcare. We still have such a huge capacity gap, both in terms of infrastructure, in terms of people, in terms of training. And, the tenacious side of me came up again to say, can't stop, have to keep going. And so around that time, I'd started talking to some local investors here in Nigeria to say, okay, how can we do this? But as Nigerians for Nigeria. In the past, I had seen the ability of working with international investors, but I wanted us to sort of think more local. And that's how Iwosan was born. Wow. And Iwosan, the name itself is a local name. It's a Yoruba word, which means to cure, to heal, to look after, in terms of the healthcare sense. So to sort of make sure that we always, identify with our local roots. So we came up with Iwosan. We came up with the strategy of really investing in, again, what I'll call the provider side, in infrastructure, in clinics, in hospitals, in training. And so it was, I guess, fortune as well that then made it happen that Lagoon Hospital again was available to be acquired. And so, we went down that road. And that's how Lagoon changed hands from being Hygeia to being Iwosan.
Wow. That's interesting to know. At least it personally clears my own doubts about how it happened, sure. Right? Yeah, so I'm looking at the play of technology, right? Technology started coming, and at some point you think that, is this the right time for technology in healthcare? I could remember, I think the first major technology in healthcare was EMR, and how to digitize and all that. And so many doctors were just looking at, is this something everybody will use? So how would you think that technology has transformed how healthcare is being done here in Nigeria? And how do you also foresee its delivery now and also in the future?
I think it's getting there, but not fast enough in Nigeria. And if we're not careful, it's going to create us even being further behind in healthcare than we are. Our own first foray into technology was, to be honest, when I came back from the States, and I came back from HBS, obviously having seen the healthcare system there, having seen, trying to put together a health insurance system, it was clear that we needed technology. We couldn't do it manually. So we started first, like you said, with EMR. We tried to build our own, we worked with a few local partners. We realized that we couldn't get to scale fast enough. So in the end, we then brought in some skills from India and started working with an Indian platform. And so that meant that Lagoon was one of the early adopters of an EMR system. So we've been on EMR, I think, from about 2009 or so. And what did it achieve? It certainly achieved us being able to scale up. It meant that we could definitely see more patients, and we could definitely work better with the insurance companies because we were able to sort of integrate better in terms of claims administration,
True.
in terms of being able to give good enough information regarding diagnosis and all the information they required. But of course, more than that, we were also, as we also now started to open up other branches, we were able to allow patients to come in from different parts of the system and still integrate with our doctors and caregivers. So that was a first important step. But going on, we then realized that really we had to automate everything we're doing. So we had to automate lab, we had to automate imaging, and so on. And we've been continuing on that journey. And of course, it was very important because when COVID happened again, the healthcare system largely had to go virtual. And so being able to look after patients virtually, being able to access their records, access their images, and so on, became a way of life. And I think that's the way we see technology. Technology is just a way of life in our business and in our hospital system. And it has to become more and more like that, across the healthcare ecosystem. I know that there's a lot of, tiptoeing around it. One, first of all, can we afford it? Should we really invest in it? And secondly, how do we use it? So there's a lot of education that still needs to happen. But when you think about where technology is going now with AI and all the benefits that brings, it's something that we really have to do. I mean, it's early days, but at least the sounds we're already hearing from this current government from a healthcare point of view, the last 1 week or so has been all about digitizing healthcare and digitizing records. And I think certainly it could be a game changer.
Yeah. Interesting, very interesting. And talking about startups trying to, because they play a very great role in trying to bring technology to forefront. A lot of founders are discouraged, right? I've been in the healthcare industry for 5 years now, and sometimes I'm like, oh God, am I still going to do this? But because of the passion, I keep at it. So I'm looking at the funding landscape. How can startups and entrepreneurs get access to funding and investments, right? You see that a lot of investors are fintech oriented and they're like, that place has got so much money. So what of healthcare? How do you think startups can position, right? How can they navigate the challenges in accessing funding?
Yeah, I think it's gotten a lot easier. I mean, when I first came into healthcare, capital was one of the biggest challenges we had, truly. And the reason was and still is because healthcare is seen very much as a social good, which it is, a public good. And therefore, there is sometimes a lot of hesitancy or maybe even discomfort around how do we do this and make money from it? How do we do this and, have to think about a return? But I like to liken it to the fact that, yes, it is an impactful sector, but it's a sector that, like in any other, has to be sustainable. And financing, therefore, becomes a big part of that. And whether that is public or private, sustainability, financial sustainability is key to healthcare. So I think, first of all, startups and those who are or who want investments in healthcare need to be able to tell that story so that they can show what I will call is the double bottom line. There's the bottom line of impact just as much as there's the bottom line of profit. So really being able to show that, I think, is important. And showing that means there must be a level of transparency, perhaps more than in other sectors.
True.
Because again, we have to overcome that discomfort from an investor's point of view. And then I think with that in mind too, whether you're healthcare or any other startup, I think I'll always give this advice that for any founder, anybody who's starting up a business, again, to realize that you have to, in addition to being transparent, you also have to be sure that you can bring some governance and, shall I say, compliance into play from day one. You have to be able to show that, this is what I'm doing, this is how you have to document. You have to make sure that your numbers and your books are in order, and that you can really show a track record also of delivering. If you can show a track record of delivering, then there is more trust.
True.
And so on, and you can keep going. But like I said, there is lots more capital available. So I think if that system, if those steps are taken, there is a lot more capital available now.
Yeah, thank you very much for that. Personally, I'm thanking you because I run a startup, right? So, and I look forward to exploring, more relationships in the sector.
Sure.
Yeah, so
I think it's my turn now.
Oh, great.
To ask the questions.
Yeah, that's right.
And I think you already led me into the first one, which was what you were saying about, as being a startup. But I want to ask you as well that what would you say? You've been now in the sort of STEM sphere for a while,
yes,
right?
While,
and
yes.
particularly now in healthcare. But what would you say have been your biggest challenges as you think about yourself as a startup in the space?
I would say that when I initially started, a challenge was that I was not an healthcare person, so I had a lot of reading to do.
Okay.
I studied economics on campus, and I knew that I wanted to be a business person, but I was so passionate about healthcare because I almost lost my life. My university didn't have an EMR at the time, and they didn't attend to me. Right. So finishing school, I was like, so many hospitals do not have this. How can we create one? And in about a year, I was able to come out. While I was in the STEMs field, I was building and building. So when it was time, I got into Faith Foundation and I learned business. And I'd already read a lot about the healthcare industry, worked with a lot of doctors to build the solution. And that's how my journey started. However, it was not just building the product. It was also now navigating acceptance. Doctors were very skeptical about technology at the time. But of course, I think that one of the things I did was to build good relationship, try it out if it doesn't work. So it was more about outcomes. It was more outcome based than just using technology. And when they saw that it was faster for patients to access care, they started introducing. So we hardly did so much marketing. We just had more hospitals wanting to come on board and all of that. So that's how my journey really started. But another challenge that I encountered was funding, right? And knowing that startups are high growth companies, you have numbers to hit. And I think that in our second year, after 2 years, we had done over 400,000 patients across about, I think, 50 plus hospitals. But it was more about how can we get more for the patients, right? And that's how we transitioned into being Chekker today. And upon transitioning, I saw that people were dying. So I could feel the pain of people not having access to diagnostic services. And I, for one, my mom had cancer. And it was, I'm in the healthcare industry and no doctor could help. They were referring me to government hospitals. Government hospitals were on strike. I moved my mom from Lagos to Abeokuta, right? So that experience in itself made me build so much passion for it. And I was not deterred by the challenges. And that was how I was able to build more collaborations in the space. I think my first partner was with IFHA. So we did an indirect collaboration with AXA Mansach through Tremendok because they needed, when we came out, it just felt like they needed the service. At-home diagnostics, it's not easy. They're already consulting. Post-COVID, a lot of telemedicine solutions came up, but you talk to a doctor virtually and this doctor will tell you to walk into a lab where you have to spend some more time, right? So it didn't just make so much sense. And that's where we came in and we're able to make the entire digital health holistic. Yes, so that's how we navigated.
And maybe just, again, where you are now and having seen that growth, what does AI, how do you think AI is going to impact, what you're doing now? How are you going to be able to incorporate it?
Yes,
if you want to.
So I think it comes in the area of predictive medicine.
Yeah.
Right. And what we are doing, like earlier when we were discussing, I think I mentioned how we are building an offshoot of our product. Chekker is at-home diagnostics. For a lot of people can afford it, but there are 200 million Nigerians, of which so many people are poor. Right. So we're building another program out of Chekker. It's called Health Check Africa, where donors and corporates can sponsor health checks, monthly health checks. So it's healthcare screening and monitoring for everyone, right? So we have people already in the location. They have all the tools they need. They just come together, just like the voting system when you want to vote and all that. So we have locations across communities. And the goal is to see that we use AI to analyze data that is gotten, trend analysis. And it's a case by case scenario where we're able to now send people, okay, once you've had this for maybe high blood pressure and it's not going down, right? We're able to now say, okay, do this. But it's AI algorithm that will help us manage the numbers. So, and also writing some machine learning models such that even without a doctor's interference, we already know that once numbers are this and this and that, this is what should be done, right? So that is a major area that technology will play, especially AI and machine learning. And right, for us, on the business aspect of it, right, at Chekker, we know that patients want to do some checks, even without having to even have somebody come to do certain things for them. And I was talking to an investor like last week about like solutions, innovating solutions that can help in making it easier for people to get tested, even without going to the lab, right? So that is one area we're also looking at. We're investing so much in research, and we are sure that with time, we're able to build more technologies that can help.
Great.
Yes. Thank you very much for this very amazing session. I mean, I think this session was for me and for millions of other people that are going to watch this video. So to everyone out there, if you're watching this, I'm sure you've learned one thing or the other. So many things, I must say. And I want you to keep on doing what you're doing. Do not relent and keep making impact. Cheers.
Thank you for watching this episode of Journeys in Entrepreneurship. This interview was recorded on the 15th of September 2023 at Faith Foundation's office in Lagos, Nigeria. We look forward to hearing about your aha moment in the comment section below, and watch out for the next episode.